the Honorable Prime Minister of St. Kitts, Dr. the Honorable Denzil Douglas, the Deputy Secretary General of CARICOM, Ambassador Lolita Applewhite, the Director of the Pan American Health Organization, Dr. Mita Rosas, Mrs. Myrna Bernard, the Head of Human and Social Development at CARICOM, ministers, colleagues, all. It gives me great pleasure this afternoon in chairing this opening ceremony of the Caribbean Public Health Agency. Later this afternoon, I will make some remarks, but I believe this has been a remarkable week for the CARICOM region. Today, we inaugurate our own public health agency, and in so doing, a dream has become reality, a dream that many public health practitioners have had for many decades. This follows a week in which a high-level meeting on the NCDs was held at the United Nations at the beginning of the week. A high-level meeting which means much to our regional development and global development, and a high-level meeting which we in the Caribbean can take pride of playing a significant part in bringing that meeting into reality. This has been quite a remarkable week for us in the Caribbean, and we share these successes with our partners, and particularly with the Pan American Health Organization. And in many ways, it is fortuitous that we are here with the inaugural meeting of the Caribbean Public Health Agency at the home of the health of the Americas. Joining me this afternoon in this opening ceremony is the Prime Minister of St. Kitts, Dr. Denzil Douglas, the Honorable Dr. Denzil Douglas, the Deputy Secretary General of CARICOM, the Director of PAHO. And at this point, I would like to ask Ambassador Lolita Applewhite to make some remarks.
Thank you, Chairman. Honorable Dr. Denzil Douglas, Prime Minister of St. Kitts and Nevis, CARICOM Lead Head of Government for Human Resources, Health, and HIV and AIDS, and Chairman of Conference of the Caribbean Community. Dr. Leslie Ramsamy, Chairman of the CARPHA Steering Committee and Minister of Health of Guyana. Dr. Mita Rosas, Director of PAHO, Ministers of Government of Member States, other members of the Executive Board of CARPHA, staff of the CARICOM Secretariat, and staff of CARPHA. Distinguished guests, On behalf of the Caribbean Community Secretariat, I wish to add my words of welcome to all of you present at this landmark occasion, the inaugural meeting of the Executive Board of the Caribbean Public Health Agency, CARPHA. After several years of assessments, debates, and resolutions based on numerous feasibility studies and reports, the moment has arrived when this board will actually preside over the virtual beginning of the future of CARPHA, to borrow a phrase coined by Winston Churchill. This board is charged with the responsibility for charting the directions of CARPHA by approving its strategic plan, appointments to staff positions, and the technical advisory committees, by devising mechanisms for the prompt exchange of information among its members and between the board and the various stakeholders, by promoting cooperation in education and public awareness, by supervising the mobilization and disbursement of resources and all other fiduciary matters related to accountability and good governance. In addition, the board is responsible for overseeing the agreements between the CARPHA Directorate and external agencies, as well as to monitor the implementation of the transition of the 5 regional health institutions to a consolidated CARPHA. This is indeed an exacting range of tasks, compounded by the fact that there are great expectations about the outcomes from this agency. I feel very confident that under the able chairmanship of Dr. Honorable Leslie Ramsamy, the longest-serving CARICOM Minister of Health, and with the commitment of the other members, the Executive Board will respond to the challenges and emerge with flying colors. More than most other executive boards, you will no doubt be confronted with actually establishing the framework for your operations, as this is the first of its kind for the community, where formerly independent institutions are being consolidated under one governance arrangement. There is no model, no blueprint, no precedent, and no conventions on which to chart your course. Yet there is a well-articulated vision and mission for CARPHA, an agreed decision-making structure, and firm guidelines in the articles in the Intergovernmental Agreement establishing CARPHA. Our heads of government have endorsed the establishment of CARPHA based on a series of assumptions. Among them is the fact that as a consolidated agency, it would provide services beyond the scope and affordability of any nationally driven institutions. As an entity that combines the expertise formerly located in 5 separate systems, it is reasonable to believe that its potential to become a center of excellence is assured. Its contribution to the economic well-being of the community is predicated on the close links of its programmatic agenda to the elements of health promotion, the strengthening of public health leadership, the support for policy research and programmatic development of its overall public health agenda to respond to the needs of critical economic sectors such as tourism, transportation, agriculture, and industry, to name a few. CARPHA, as presently conceived, will be an asset to our region, providing, as it will, a laboratory and surveillance system that is highly responsive to natural disasters and for the innovation in information, education, and communication techniques envisaged to connect the national public health priorities in a coherent and constructive manner. As the CARICOM community endeavors to consolidate its integration process, CARPHA has a vital role to play in demonstrating the value of health to development and increasing the benefits of health for all by contributing toward the reduction of health inequities. CARPHA could also play a strategic role in the fight against NCDs, which received global attention last week at the UN high-level meeting in New York, as mentioned by Dr. Ramsani. These are some of the fundamental prerequisites for success facing this executive board. Notwithstanding its own internal financial challenges, the CARICOM Secretariat has contributed as best as it could to this transition process and will continue to do so. We recognize, however, that in the context of the ongoing global financial crisis, mobilization of resources will continue to pose a challenge. We have to find a way to support this very important endeavor, so vital to improving the health conditions of our region. Our new Secretary General, Ambassador Erwin Larocque, joins me in thanking PAHO, the Public Health Agency of Canada, and the UK Social Marketing Corporation for their continued and sustained support for this transitional phase, and the Ministers of Health and other health officials, in particular the Director of the RHIs, for their continuing support. We wish to extend our appreciation in particular to the government of Trinidad and Tobago for moving forward with plans for the relocation of CAREC and for agreeing to host CARPHA. We thank our partners from the Dutch and French Caribbean for being present, as well as representatives from the Pan American Health and Education Foundation, the Commonwealth Business Coalition, and TDV consulting firm. We recognize, however, that without the commitment of the CARPHA Steering Committee and the advisory group that spearheaded the preparatory work over the past 3 years, we could never have reached the stage of convening this inaugural meeting of the Executive Board. I extend my appreciation for their commitment to the task and my congratulations for a job well done. I wish you, participants, a successful meeting which will truly launch CARPHA on the path to being a beacon of hope for health and well-being of the people of the Caribbean for generations to come. Thank you.
Thank you very much, Ambassador. It's been 3 years that we started this process of bringing Caribbean Public Health Agency into reality. Through that period, the CARICOM Secretariat played a significant role. There were many frustrating moments, and with her personal commitment and leadership, the director of the Pan American Health Organization remained as a constant partner. This afternoon, we are happy to have the director here present with us, and I would now ask the director of the Pan American Health Organization to make some remarks.
Thank you, Minister, and we are really honored to have the Honorable Denzil Douglas, the Prime Minister of St. Kitts. I was telling him that we have been seeing each other every day almost this week. As mentioned by Minister Ramsamy, this is a very active week that started, in fact, you know, the weekend before in New York with many kudos and recognitions to the leadership of the heads of government and the people of the Caribbean and CARICOM for moving forward the agenda of NCDs and having such a wonderful meeting and declaration passed without any controversy in New York. We are also happy to have again Honorable Lolita Applewhite here in the House, and some of the ministers for the first time, Minister Trinidad and Tobago, welcome, and other members of the CARPHA Executive Board and those who have been serving and supporting CARPHA along the road, particularly those in the Steering Committee and the Special Advisory Board. Sir George Alin, now sitting there as Yui, our Deputy Director Emeritus, and the directors of the regional health institutions here accompanying us. Welcome all. The partners that have also been following and supporting the process as we move forward. This is the first, in fact, day already of our Directing Council, because we are going to move with the traditional caucus of the Ministers of the Caribbean and CARICOM over the weekend, and then starting officially the 51st Directing Council. But today I would say that we are particularly pleased to have this occasion, very, very special, because it is the first meeting of the Executive Board of CARPHA, and it marks an important milestone. I think that's why we have all these colleagues here registering for the history. The first meeting of the Executive Board. This will have to be kept in the memory of CARICOM, in the institutional memory of CARICOM as a critical milestone. We have been a strong believer and, of course, also a partner in the establishment of CARPHA since the inception back in 2002, when the heads of government initiated the whole process by mandating the review of the regional health institutions, the 5 of them. I think that some of the colleagues around here have participated in that process, and I'm happy to see some of those faces still here, helping move the dream come true, as it was mentioned before. And I would, I think from PAHO we have tried to give the political and the strategic and the technical support whenever it was required. And even if it was not required, we passed our own ideas and suggestions out of love and of course interest of the organization to see the Caribbean establish a strong public health agency. We have been also advancing funding and providing the logistical support to enable the creation of this important agency for the Caribbean. Always trying to be alert, to mobilize the resources and to seek the support and the approval of all the member states of the organization, and to be able to keep, the process moving. So it's very motivating to see that we have succeeded and that we are now reaching a point where the institution has already a legal support basis, and it's an entity in itself. I would like to thank CARICOM, first of all, for considering PAHO an important and trusted partner in the process. I'm particularly pleased that we have been invited to be part of the Executive Board, and the organization will be represented by Dr. Socorro Gross, the Assistant Director, who has already been participating with many of you in the governing bodies of the 2 centers, the CAREC and CFNI. And we look forward to continue collaborating closely with all CARICOM member states and other partners to ensure that CARPHA effectively delivers its mission for the benefit of the people of the Caribbean. Like any other intergovernmental agency, the CARPHA governance structure is critical for balancing the agency's mandates with member states' priorities and needs against the agendas of different stakeholders. So the Executive Board is going to be playing a critical role in ensuring that such a balance is maintained. In line with the principles of functional cooperation and regional integration, CARPHA should be the leading agency in addressing the common public health challenges faced by the member states as identified in the Caribbean Cooperation for Health Phase 3. And will continue to explore mechanisms that foster the close collaboration with CARPHA to realize better health outcomes for the Caribbean. It should be noted that the challenges faced by the sub-region, like now we have been all talking about chronic non-communicable diseases, will require the commitment and the support from other partners. As identified in the CARPHA Resource Mobilization and Sustainability Plan, which is the TDB draft report you have, and I quote, "The sustainable funding of the Caribbean Regional Institution has long been a challenge of the integration movement," unquote. In order to guarantee CARPHA's viability and its ability to respond to the various public health challenges of the Caribbean, it will require a firm commitment from both the member states and the partners to assign the necessary resources. At the same time, the agency will need to demonstrate its strategic, technical, and management leadership to achieve results in order to garner the support needed from the different stakeholders to effectively carry its functions. PAHO will continue supporting the agency's resource mobilization strategy, including building the necessary alliances and synergies with all the different partners. In order to facilitate the continuity of the work and avoid unnecessary delays, PAHO has been filling all funding gaps as possible in emergency situations, as well as providing office space and technical administrative support to the CARPHA project managed team, particularly for Dr. Walcott, and the who is the CARPHA project manager, and I would like to recognize his work at CPC Barbados, and Dr. Pate is accompanying us today. And also to Dr. Green, the Special CARICOM External Relations Advisor for CARPHA at the OAS building here in Washington. I'm glad to inform you also that draft transition plans have been developed for both CAREC and CFNI. Such plans will be reviewed with the CARPHA implementation team to ensure a seamless transition process. We have also been supporting the government of Trinidad and Tobago to analyze their needs and support the process for their own national public health lab, as well as for the relocation of CAREC and the needs assessment plans for the future CARPHA location. Just to reassure you, I think that it's also important to know that we have successfully gone through a similar process of separation and devolution of INCAP, the Institute of Nutrition of Central America and Panama, and we are proud to say that the center is now fully relocated into the Central American Integration System, and that we as PAHO continue allocating the resources as identified in the program of work and budget through a joint mechanism with INCAP, and this has provided a lot of lessons and a good experience to apply for the process that we are carrying out with the CARICOM. Similarly, then we will maintain the proportional resources allocation to CARPHA within the sub-regional level of the PAHO budget, biennial budget, according to the jointly agreed plan of work and budget of CARPHA and PAHO aligned goals. So I give you again a warm welcoming on behalf of all the staff in the organization. We are ready to support your deliberations today and over the weekend and then the following week during the Directing Council. But I look forward to our continued collaboration with the CARPHA Executive Board and the implementation team as soon as we have that also concreted and based in Trinidad and Tobago, so that we can ensure bringing CARPHA to full fruition. Thank you.
Thank you very much, Dr. Rosas. Our next speaker is one whom we owe a deep debt of gratitude. Leaders shape the future. The heads of government of the Caribbean were visionary when they set us on the path towards the establishment of the Caribbean Public Health Agency. They took a bold step, and today we can look back with pride that we do have our own Caribbean Public Health Agency. In creating that vision and in taking the bold steps, the Prime Minister of St. Kitts Nevis, Dr. the Honorable Denzil Douglas, led from the front. The Ministers of Health and the public health professionals of the Caribbean will forever be indebted to the role that the Honorable Prime Minister of St. Kitts Nevis has played. In many ways, the record time in which the Caribbean Public Health Agency has been established is due to the hard work and the dedication of the Honorable Prime Minister. I now have pleasure in introducing the Honorable Prime Minister of St. Kitts Nevis, Honorable Dr. Denzil Douglas.
I want to join the Chairman, Dr. M. Sami, our Deputy Secretary General of CARICOM, and Mrs. Bernard, and of course our distinguished Director of PAHO here at the head table, in expressing very warm greetings to you all in the audience here in this meeting, but in particular to our Ministers of Health and the other members of the Executive Board who have the responsibility for piloting this noble venture which we are gathered here this afternoon to launch. I also extend heartfelt appreciation to the members of the CARPHA Steering Committee and Advisory Group, as well as the Director and staff of PAHO, the Deputy Secretary General and staff of the CARICOM Secretariat, the CARPHA Program Manager and team, and the directors of the regional health institutions for your sterling efforts in getting us to this stage in the evolution of CARPHA. And I bring these words of heartfelt appreciation on behalf of the entire Caribbean community, especially the heads of government of the Conference of the Caribbean Community. This meeting is occurring today at a time when CARICOM and indeed PAHO must feel a very deep sense of pride for the leadership given to the world in the recently concluded United Nations high-level meeting on non-communicable diseases. You must understand the pride and honor I personally felt when I listened to the comments over the last 2 days in New York as people expressed openly how much the Caribbean, CARICOM, PAHO have been able to achieve in moving the entire world to recognize and take effective action on a matter that is a global issue that confronts not only the developing countries, but the developed countries as well. I emphasize that the whole matter started when, in fact, the Caribbean community was recognized as the initiator of this global event with the landmark Port of Spain Declaration of 2007 that united to fight the NCDs. And this was pursued, obviously, as our catalyst. It was the Caribbean community that held the first ever summit of heads of government on NCDs. It was the Caribbean community that provided that conceptual framework for the outcome document at the United Nations, as indeed most of the 15 actionable recommendations of the Port of Spain Declaration are fully reflected in the United Nations resolution. For this, we refer with pride to the empirical and seminal study by the Caribbean Commission on Health and Development that was then chaired by Sir George Allen. This report armed us with the evidence to advocate for an accelerated approach to NCDs. We exported the ideas of Wellness Day and Wellness Week as symbols for reducing the health risk and for behavior change among our people. We provided the model by which the world will engage in monitoring and evaluating the implementation of the UN resolution based on a scorecard approach. And while the final resolution fell somewhat short of the tangible outcomes that we had expected, it nevertheless provided the basis of a global partnership including governments, the private sector, and civil society to combat diseases that account for approximately 70% of all deaths throughout the entire world. It is therefore with great enthusiasm and expectations carried over from the events in New York earlier this week that we approach our assignment here in Washington, D.C. at this very landmark event. I wish to emphasize that we have arrived at this juncture for CARPHA after very careful consideration of all factors involved. Several expert studies have been done. Our experts have debated the issues. These debates included our own CARICOM councils and involved our ministers, our officials, academics, business sector, and other stakeholders. Notwithstanding disagreements over the details, the overwhelming burden of opinion resulted from this interactive process led to a considered decision by the CARICOM heads of government that the consolidation of the 5 regional health institutions into one agency was our most effective option. In so doing, the CARICOM heads of government carefully examined the proposals related to the governance arrangements, the phased integration of the functions and staffs of the regional health institutions into CARPHA, and the cost efficiencies. The government of Trinidad and Tobago also scrutinized the proposals for the relocation of CAREC and the hosting of CARPHA. And so also did PAHO with respect to the feasibility of collapsing CAREC and CFNI into CARPHA. In addition, as you've heard from the PAHO director herself, there remains a continuing commitment by PAHO to support the technical cooperation programs of member countries during and after this transition period. I mention these steps only to reinforce the point that CARICOM has exercised due diligence and has come to the conclusion that CARPHA, as currently conceived, is the most expedient way to organize and service the region's public health agenda. We therefore expect the Executive Board to be the vanguard in the accelerated approach for this region's public health agenda. There is a prominent view among most experts that major advances in improvement of health over the next decades will not come from new medical findings or cures, but instead the broader development and application of population-based prevention programs. Our public health agenda must engage in mitigating natural disasters, to which we are quite prone. It must contribute to an environment in which our health conditions are conducive to enabling our tourism industry to attract our patrons. It must foster institutional strengthening of our health delivery systems with greater emphasis on health promotion and disease prevention. I emphasize that our public health agenda must increase awareness of the public about the effects of toxic waste and pollutants on their health. It must place emphasis on assuming the safety of our own communities as well as workers' health. These are essential ingredients for reducing the cost of care and simultaneously improving the health of our populations. For these objectives to be achieved, there is need to create a broad array of new opportunities for professionals with advanced training in public health, as well as to increase the support for research and development, focusing more on women's and children's health and on substance abuse. In this regard, the imperative is behavioral change to prevent the risk of STDs, HIV/AIDS, tuberculosis, and unplanned pregnancies, school health, and the health of disadvantaged populations. CARPHA offers the scope for establishing the principles and practices of functional cooperation, so fundamental to our regional integration mission, as it is intended to reach beyond the CARICOM states to the Pan-Caribbean region, to include the Dutch, the French, and the Spanish Caribbean. Hence, it is with great delight that I recognize the presence of the representatives from Aruba and from the French Antilles among the gathering this afternoon. In fact, it was just yesterday that we of CARICOM Secretariat engaged the Prime Minister and the team from Curacao, who have applied formally to become associated members of the Caribbean community. Naturally, they too would be part of CARPHA. It has to establish those links with the universities and research centers, regionally and internationally. That Professor Nigel Harris, Vice Chancellor of the University of the West Indies, is being represented here. And also we have representatives from the Center for Disease Control, the United States of America, participating via the Illuminate webcast, are also most welcome signs as to where we are going with CARPHA. I emphasize, ladies and gentlemen, that the future of CARPHA will depend on the support from all of its partners. In this regard, we recognize and we thank the Public Health Agency of Canada, United Kingdom Health Action Partnership Institute, and the National Social Marketing Corporation, whom we view not as external agencies anymore, but as integral to the process of CARPHA's development and its sustainability. I wish to remind us that Article 9, Section 3 of the IGA states that the chair of the COSOD shall be the chair of the Executive Board of CARPHA. I inform you that that person is Dr. Leslie Ramsamy. The challenge, therefore, for the Executive Board is to chart a course for the sustainability of CARPHA. This requires creative leadership and commitment. I personally offer you my best wishes and those of my colleagues of the Caribbean community. We offer you our support in this very important journey. And so may your deliberations this afternoon and in the future be successful. God bless you. Thank you.
Thank you very much, sir. Instead of waiting for the future, we are shaping the future. The Caribbean Public Health Agency is now part of the landscape of the Caribbean, and because of that, the Caribbean is better today than it was yesterday. I want to thank all of our speakers this afternoon. This has been indeed an auspicious event, and one that will be etched into the annals of our history in the Caribbean as one of the very most important achievements of the Caribbean. I thank you all very much. At this time, I'll adjourn this session to allow the Honorable Prime Minister to leave, and then we will resume for the inaugural executive meeting of the Caribbean Public Health Agency. Thank you all very much.